Good evening. Good evening, Arnav. Uh, am I audible? Just let me know if I'm audible. Yeah. Yes, thank you. Okay, okay. Chalo, we'll start and let's continue. So I'm going to take the pharmacology rapid revision. So basically, as you know, that these questions are more important for the INICET, not really important for the other kind of entrance, and not much focus should be actually given to these drugs otherwise. But I will be dealing with some questions and we'll rapidly go through what are the key points to know in this chapter of anti-cancer, and do not waste much time on this chapter as such apart from the important things, because there are other more important things which you can really work on, right? So let's see the first question. The first question is, if it is visible, wait. So which of the following drugs act at the stage marked with the arrow in the cell cycle picture shown below? ठीक है, so red arrow पे which of the following drugs? Paclitaxel, vincristine, etoposide or methotrexate? ठीक है, which of the following drug acts at the stage marked with the arrow? Which one is it? Methotrexate. Yes, it is methotrexate. So just briefly going through what all is happening in this. These are the various drugs acting at the different phases. So what are the important key points to know about these drugs? These are cell cycle non-specific. जो cell cycle non-specific हैं, they are your alkylating agents, right? Then we have the platinum compounds. Then we have your L-asparaginase, and then we have your anthracyclines. ठीक है? So cell cycle non-specific है because question has come on cyclophosphamide, whether this is cell cycle specific or non-specific. So remember that Alka loves the platinum and the rubies, so इसलिए rubicins वाले platinum Alka loves these, so all of them they are cell cycle non-specific. So another important thing about cyclophosphamide are its metabolites, which has been asked. I'll be telling you. So इसका important metabolite is 4-hydroxy cyclophosphamide. पूछा गया है 4-hydroxy cyclophosphamide. ठीक है, that is important. And the other important metabolite जो उसका है acrolein, right? So other important metabolite is acrolein. This acrolein is responsible for its hemorrhagic cystitis. It is responsible for the hemorrhagic cystitis. ठीक है, and the treatment for this hemorrhagic cystitis is, yes, Mesna. This is important thing to know about cyclophosphamide. Yes, one thing. Efosamide, similar toxicity. It is even more, this toxic, nephrotoxic, even neurotoxicity, which is seen with efosamide. Similar cheese hai. जो highlighted with yellow are very very important, have been asked before, so that's why. Now busulfan, the important thing just to know is that it causes pulmonary fibrosis. It causes pulmonary, yes, very good. So pulmonary fibrosis. A pulmonary fibrosis is an important question as a whole. All the drugs which cause pulmonary fibrosis, you can remember by the mnemonic BBC, ban me. ठीक है, bleomycin, busulfan, cyclophosphamide, bromocriptine, amiodarone, nitrofurantoin, methotrexate. So BBC, ban me, is an important mnemonic to remember for all the drugs causing pulmonary fibrosis. Any drug can be asked. This is because amiodarone was asked in the recent NEET PG. Busulfan has been asked before, so there are chances any of the drugs can be asked in the future. ये important है about this, ठीक है. Then coming to the next is the platinum compounds, और platinum compound में cisplatin is the most important, ठीक है, because the rest are similar. Cisplatin is the most, yes, so cisplatin is the most important. तो इसके लिए हमें जो दो चीज़ें important है, that is, it is, one is nephrotoxic and it is highly emetogenic, ठीक है. एमेटिक पोटेंशियल इसका बहुत हाई है. सिस्प्लाटिन द मोस्ट हाईली एमेटोजेनिक ड्रग, ठीक है. सो दीज आर द टू थिंग्स विच आर वेरी इंपॉर्टेंट फॉर दिस पर्टिकुलर ड्रग. सो नेफ्रोटॉक्सिसिटी के लिए व्हाट यू कैन डू इज यू कैन गिव अ नॉर्मल सेलाइन IV infusion 1 to 2 liters. So basically can flush off the vesicotoxic compounds. So you can give normal saline IV infusion 1 to 2 liters before it. I'll be dealing with ADR separately also. Yes, it is highest emetogenic, or I'll be dealing with, I'll give you a slide with all the ADRs, the must know ADRs, and वहाँ पे हम again we are going to do, so it is just a reference क्या क्या important है. और emetic potential है, and you know that it can cause early emesis और delayed emesis, ठीक है. अगर early emesis है, इसका treatment होता है 5-HT3 antagonists like ondansetrons and danisetrons. Delayed emesis, which occurs, it doesn't occur on the first day, occurs later, uska treatment here is epripetant. So delayed emesis is treatment is epripetant. Early ka we give ondansetron and like drugs, right? Amifostine also, that can be, it's a radiosensitizer also, amifostine, plus it has bound to be effective. It protects the kidneys when you're giving cisplatin. So yes, amifostine is another one, though I've taken up, and it's a radio, protects radiosensitizers may protect karta hai, rather not sensitizer, protection. So then this is about cisplatin, which is more important. Baki oxaliplatin is one drug which is it is usually reserved for resistant cases, okay? So because the cancer cells haven't yet developed resistance to this, so this is reserved for resistant cases, and iska ek peripheral neuropathy is a side effect, adverse effect rather, peripheral neuropathy, ठीक है. L-asparaginase. L-asparaginase का एक important point आप याद रखना है. It has a bone marrow. I have another question for, then we'll discuss the other details about L-asparaginase. But it has a bone marrow sparing effect. What does it mean? It has a bone marrow sparing effect. That iska side effect, it doesn't have any side effect on the bone marrow. Bone marrow depression is not seen with this. And other two drugs which have a bone marrow sparing effect are, yes, other two drugs which have a bone marrow sparing effect are bleomycin. Yes, pancreatitis also you can write, but SR. Yes, I will tell you the details. I will, when I go through the asparaginase separately, I'll tell you the important side effect with L-asparaginase. Abhi, I'm just telling you the other important features. So it is a bone marrow sparing effect. Bleomycin or vincristine also, very good. Vincristine also has a bone marrow sparing effect. So these three drugs have a bone marrow sparing effect, which is important to know here, right? Coming to your anthracyclines. So anthracyclines में याद रखो, जैसे जिसमें भी rubicin है ना. So these are the most cardiotoxic drugs, ठीक है ना. और हमें cardiotoxic याद इसलिए रहता है because it has ruby in it. Ruby means red. Red is the heart. So they are most toxic to the heart. Most cardiotoxic drug. They can cause even cardiomyopathy, which is life-threatening. ठीक है. and इसमें एक epirubicin has been tried in the breast cancer. There was a one question कि which of the drugs following drugs are used in the cancer of breast. तो वहाँ पे एक option था epirubicin. So remember this epirubicin is used in the breast cancer. Right? ये है cell cycle non-specific drugs. Now let's go to the cell cycle specific drugs. Which are the important radiation recall syndrome is seen with doxorubicin, but it is also seen with the other immune checkpoint inhibitors. I'll show you a picture of that radiation recall syndrome. It's also seen with many, and yes, doxorubicin has the most potential to cause radiation recall syndrome, but even the immune checkpoint inhibitors also, agar aata hai, they also cause radiation recall syndrome. The anthracyclines also cause. ठीक है? So that is another thing, radiation recall syndrome. Cardiotoxic तो है ही है. Okay, then G1 phase में we have etoposide. ठीक है? So etoposide, nothing really great, को ज़्यादा इसमें याद रखने पूछा नहीं गया. So just remember this is specific for G1 and also on the G2. ठीक है? टोपो आइसोमरेज इनहिबिटर है तो G1 में भी काम करते हैं and G2 में भी काम करते हैं. So they you can remember both. Then coming to the important, which is your S phase or the synthetic phase, where the synthesis is occurring. Now methotrexate, another very very important drug to remember. So methotrexate ka mechanism has been asked. So it is the inhibitor of dihydrofolate reductase. ठीक है? Another, so therefore it is useful in various cancers. ठीक है? So it is useful in choriocarcinoma, it is useful in ALL, non-Hodgkin lymphoma. That is the reason, because it has a dihydrofolate reductase inhibition. Another important thing, that it increases the levels of adenosine when it is given in low dose. ठीक है ना? Low dose में. लो डोज में ये वाला जो इफेक्ट है, दैट इज रिस्पॉन्सिबल फॉर इट्स एंटी इन्फ्लामेटरी इफेक्ट, which is useful in rheumatoid arthritis. So it works by all these two mechanisms, dihydrofolate reductase inhibitor, and it also works by the increasing the adenosine levels, and that is responsible for its anti-inflammatory effect, which is seen in rheumatoid arthritis. ये इसके दो actions, mechanisms. So please, mechanism of action is very very important to know about these three drugs, right? Now then coming to its side effects. So side effects, you know, इसका सबसे ज़्यादा side effect है एक bone marrow depression. इसका one of the side effects is there, right? And it can also lead to hepatotoxicity. Yes, hepatotoxicity. Hepatotoxicity है और bone marrow depression है. These are two important adverse effects with methotrexate. And what else is important here? How you can prevent this toxicity? By giving, yes, what do we give? Folinic acid. Other name is leucovorin. Another name citrovorum. ठीक है? Citrovorum factor, leucovorin, या folinic acid. We can give these drugs, and therefore what it will do, they will prevent the toxicity, the bone marrow depression and the other toxicity. It can decrease the toxicity. That's how we can use methotrexate at higher doses. Yes, leucovorin. तो कोई भी आपको आ सकता है, anything. Folinic acid is also right, citrovorum factor भी है, और leucovorin. Anything is good. The second one, there's another important think about, अगर बहुत toxicity है and you want to give something in extreme cases, then what you will give? You will give a methotrexate cleaving enzyme. Methotrexate cleaving enzyme. And what is the name of this methotrexate cleaving enzyme? Glucarpidase. ठीक है? Glucarpidase, it is a methotrexate cleaving enzyme. In extreme cases of toxicity, you can use this. Yes, glucarpidase. Very good. So this is important about methotrexate. Coming to pemetrexate, basically, and इसमें what is important to know here is that it causes a condition called as hand-foot syndrome. ठीक है? It causes a condition, pemetrexate, a condition which is called as hand-foot syndrome. ठीक है, हैंड फुट सिंड्रोम. एंड ट्रीटमेंट डेक्सामेथाजोन, ठीक है, स्टेरॉइड देंगे. प्रिवेंशन is you can give vitamin B12 also, you can give folic acid also, you can give for prevention. ठीक है, so these are the important side effects. So again I will mark it as question. ठीक है, so ये सारे questions ही हैं, they have been asked before. 6-mercaptopurine. 6-mercaptopurine, what is important? That what happens if you give it along with allopurinol? What happens if you give it along with allopurinol? Yes, yes. What happens if you give it along with allopurinol? The level of 6-mercaptopurine will be high. Level of 6-mercaptopurine will be high. The reason, 6-mercaptopurine is metabolized by the enzyme xanthine oxidase. And allopurinol, what does allopurinol do? This allopurinol, it is going to inhibit xanthine oxidase. So it will increase the level of 6-mercaptopurine. Yes, toxicity. So you have to decrease the dose of 6-mercaptopurine with allopurinol. So if there are sometimes, because they ask you which of the following statement is true, so dose of 6-mercaptopurine has to be decreased with allopurinol, has to be increased with allopurinol, no change. So you know that dose of 6-mercaptopurine has to be increased with, decreased with allopurinol. ठीक है. Then coming to 5-fluorouracil, इसका एक pro drug है capecitabine, if that is asked. Same actions. So the important इसमें जो 5-fluorouracil, again it causes hand foot syndrome. It causes hand foot syndrome, right? And the regimes in which 5-fluorouracil is involved, I will detail बाद में करेंगे. Folfox, yes, and Folfiri. ये regimes are important. ठीक है, Folfox, Folfiri. So Folfox, Folfiri, ठीक है. 5-fluorouracil है, folinic acid है, not folic acid, folinic acid. 5-fluorouracil, इसमें oxaliplatin है. इसमें दो first two are the same. The IRI is irinotecan. ठीक है. These regimes are important for, yes, colorectal cancer. Very good. Colorectal cancer के लिए these two regimes are highly important. Then hydroxyurea. The only thing I think which is important for hydroxyurea is its use. It is used in sickle cell anemia. ठीक है. And that this drug is a radiosensitizer. That the question अभी तक इसी पे आया है. Sickle cell anemia and radiosensitizers. Nothing much we should, there's no detail is required, right? Yes. Then coming to drugs acting on the G2 phase. Now the next phase is G2 phase. So इसमें your topoisomerase inhibitors. Topoisomerase inhibitors involved. So any drug which contains topo, you remember two drugs which contains topo in the spelling, which is topotecan and etoposide. Yes. Topoisomerase inhibitor, topotecan and etoposide. फिर topotecan के साथ मिलती जुलती ड्रग कौन सी है टीकन वाली? It is irinotecan, right? So you can remember like that. Those drugs जिसमें topo बीच में, etoposide, topotecan, and a drug which has similar name to topotecan is irinotecan. ठीक है, these are two. This is a separate. Bleomycin is separate. It is not a topoisomerase inhibitor. It's an antibiotic. So this is separate. Right? That is important about this one. And now here the side effect. एक side effect which I want to discuss is especially with irinotecan. What is the side effect that it is seen with irinotecan is your diarrhea. And why is this diarrhea there? Why is this diarrhea there? The reason for diarrhea is, yes, because it has a cholinergic effect. Cholinergic effect. It has a cholinergic effect because cholinergic effect क्यों है? It inhibits the enzyme. Clickner Rajar, okay, contraindicated. Acetyl cholinesterase. It inhibits the enzyme acetylcholinesterase. Therefore, there is increase in the levels of acetylcholine. ठीक है? Increase in the levels of acetylcholine. Increase in the levels of acetylcholine, right? Therefore, it has a diarrhea. So, acetylcholine effects on the muscarinic diarrhea. Yes. Okay, so that is important about irinotecan. Another important thing here, now let's talk about the second one, which is your bleomycin. So bleomycin, already I've told you one thing, that it causes pulmonary fibrosis. You remember that mnemonic BBC ban me. ठीक है, BBC ban me, it causes pulmonary fibrosis. और एक दूसरा side effect भी इसका एक important है, जो कि can be asked you in the form of picture, can be asked you as such, which is your flagellate dermatitis. ठीक है, flagellate dermatitis. Yes, flagellate dermatitis. These two things are important for bleomycin. So let's see the pictures here. Pictures में अगर हम देखें, so what is the first? If they show you a photograph of the first photograph, अगर identify करना हो, name the condition तो नहीं, what drug causes this condition? The first picture. Yes. So the first picture, if you can see, what is this? This is a picture of flagellate. So either, they can ask you in the picture form or they can ask you in the text form. जो भी form है, that will be, visible. Answer same रहेगा. Flagellate dermatitis, right? Yes, it is caused by, very good, bleomycin. और दूसरा है hand and foot syndrome. Hand and foot syndrome caused by 5-fluorouracil, capacitabine, pemetrexed. Yes, pemetrexed. All these can cause hand and foot syndrome. Very good. ठीक है? So any of this can be asked. All right. Then we are left with the M phase. Important है M phase में. तो उसमें है आपके विनका alkaloids, taxanes. ठीक है? विनका alkaloids हैं, taxanes हैं, and a drug which is called as ixabepilone. Ixabepilone, विनका alkaloids. ठीक है? So what is important here is mechanism is sometimes asked. You have to understand what is the difference in the mechanism. जो ये vincristine like drugs है, विनका alkaloids, they are going to inhibit the microtubule polymerization. Right? So they bind to the beta unit, ठीक है, of this microtubules, and they inhibit the microtubular polymerization. ठीक है? And this polymerization is important. The growth of the microtubules. This is important because if this doesn't happen, then the daughter cells, they won't be formed. This will not separate. The chromosomes won't separate, the daughter cells are not formed. So it is important polymerization. So it will inhibit the polymerization. That is one thing. This is done by विनका alkaloids. जो taxanes हैं जिनमें tax आता है spelling में tax, except for this eramustine is different, right? इसमें what is the difference here is that they inhibit the taxanes. They inhibit the depolymerization. So once what happens here, yes, they inhibits the paclitaxel, promote nahi. How will they promote? They will inhibit the depolymerization. Actually क्या करेंगे इसके बाद इसी when this polymerization जब होता है ऐसे, ठीक है, ये ऐसे हो गया polymerization, and then they will stretch, they will pull these chromosomes away, right? So they get depolymerized. Shrink होना है ना उनको, they have to shrink, they have to again that's called depolymerization. So it is important. So this has gone here, this has gone here, this has gone here, this has gone. So this step is prevented or inhibited by the taxanes. This is the difference, this is inhibited by taxanes. Okay? The last one, which is your ixabepilone, it causes stabilization. Hille kaam hi nahi karne dega. It stabilizes the microtubules. So it doesn't allow it to work only. So this is the key difference, because the question has been asked on these. What do they do actually? Okay, so what do they do? So this is the basic difference between the mechanisms of these three, right? And if I talk about the side effect, vincristine or vinca alkaloid side effect, a peculiar side effect is seen with this is syndrome of inappropriate ADH, okay? Antidiuretic, that is seen with this, right? Okay. They also cause peripheral neuropathy. They also cause peripheral neuropathy, okay? Right. So these are the all the cell cycle non-specific as well as the cell cycle specific. Yes. Now, you can just note down, these are some of the drugs which are your radiosensitizers. Sometimes they ask you which one of the drug is a radiosensitizer. So your radiosensitizers are drugs like gemcitabine, mitomycin, ठीक है, fludarabine, irinotecan, dactinomycin, 5-fluorouracil, hydroxyurea, paclitaxel. Just the names, nothing else more. Nothing more is required for this. These are your radiosensitizers. Okay? That's all which is important about it. Okay, so this is an overview of all the drugs, cell cycle specific and non-specific, जो हमने important points about them. Now next question was that, as I told you, it was asked in exam, active metabolite of cyclophosphamide is. Okay? Active metabolite of cyclophosphamide is was asked as a previous question. Okay? So the correct option here is, yeah, one. Okay. This one. Already done this, so this was this. So cyclophosphamide के important points हमने already कर लिए हैं, that it is a prodrug, that it gets converted into two different forms, 4-hydroxy cyclophosphamide, aldophosphamide इसका नाम है, and that is responsible for its action. The second metabolite, which is acrolein, actually is the टॉक्सिक मेटाबोलाइट, ठीक है, टॉक्सिक मेटाबोलाइट कॉजिंग हेमोरेजिक सिस्टाइटिस, एंड यू नो दैट यू कैन गिव एंटीडोट विच इज योर मेसना, ठीक है, मेसना दे सकते हैं विच कैन ट्रीट दिस. Other important side effects with cyclophosphamide which is seen is pulmonary fibrosis. Remember again the mnemonic of BBC band me, usme C is cyclophosphamide. Yes, it has also been shown to cause syndrome of inappropriate antidiuretic hormone, ठीक है, SIADH भी cause करता है. It is the drug of choice in Wegener's granulomatosis, ठीक है, Wegener's granulomatosis. These are important points about cyclophosphamide. And then efosamide has similar nephrotoxicity, ठीक है, it is also nephrotoxic, right? Yes, Wegener's granulomatosis, nephrotoxic, and even it is more neurotoxic, ठीक है. Cyclophosphamide के लिए these things are more than enough to know, right? The next one is neurotoxicity is a dose limiting side effect, or it is dose limiting for which of the following drugs? Neurotoxicity is dose limiting for which of the following drugs? Neurotoxicity is dose limiting for which of the following? Yes, very good. It is vincristine. It can cause ataxia, postural hypotension, nerve palsy, seizure, ये सारा cause कर सकते हैं. While for the others, the most dose limiting side effect is bone marrow depression, ठीक है, and we know that vincristine has a bone marrow sparing effect. Bone marrow sparing effect which is seen with vincristine. So it will not have this, it will have the other. Even if you don't know vincristine hai, so you know the others have this. It has a bone marrow sparing effect, so this is a side effect with this. Now let's come to this table. Let's do the table which has the important adverse effects. So what are the important adverse effects that you should be knowing? ठीक है, क्या क्या important adverse है जो हमें पता होने चाहिए. It is just कुछ repeat है, like vincristine हमने कर लिया, which is SIADH, right? And it causes neuropathy, and it is neuropathy, ठीक है. This is seen with vincristine. Cytarabine, it causes cerebellar toxicity. Tamoxifen has been associated with two. One is endometrial cancer. It can also cause cataract. Yes. Bleomycin busulfan, pulmonary fibrosis. 5-fluorouracil, esophagitis and hand-foot syndrome, ठीक है. Prevention के लिए we can give the folic acid, we can give pyridoxine, vitamin B12 can be given for this, ठीक है. Vincristine का हमने कर लिया. Paclitaxel already we have done. Neuropathy, it is the same actually. Doxorubicin, daunorubicin. Red is for, ruby is for heart. Red is for heart. Red color is for heart, so it is cardiotoxic, ठीक है. It is cardiotoxic. इसको prevention के लिए we can give an iron chelator. We can give an iron chelator for this. Yes. What is this? Desra. Yes, it is. Yes, Arnav, it is cardiotoxic ruby. Yes, or ruby is red. You can remember red is the color of the heart. So destrazoxane you can give. It is a iron chelator. So why we are giving an iron chelator for this effect? Because doxorubicin, it combines with iron in the body and that complex is cardiotoxic. So IV dextrazoxane जो क्या करेगा? It is an iron chelator. It will take away that iron from the complex. So it will help or beneficial in that. So that is the reason why we give an iron chelator, because जो complex form होता है between doxorubicin and iron, that is separated. It won't be formed. ठीक है? Yeah, right. Yes, it is an iron. फिर है methotrexate and 6-mercaptopurine. So methotrexate we did bone, it's okay, bone marrow depression and hepatotoxicity. दोनों है, bone marrow depression and hepatotoxicity. Methotrexate causes bone marrow depression here, both of them, and they're also hepatotoxic. So here we've already done that you can give methotrexate जहाँ पे भी होगा folinic acid. ठीक है, folinic acid, that is one thing that you can do. Yeah, or glucarpidase, ठीक है. Yeah, then pemetrexate is hand and foot syndrome. Pemetrexate is hand and foot syndrome. Cisplatin, nephrotoxic and emetic. ठीक है, nephrotoxic and emetic. So you can give antiemetics. You can give IV normal saline and you can give amifostine. ठीक है. Cyclophosphamide, efosamide, it causes hemorrhagic cystitis. Antidote या prevention is your Mesna. Irinotecan, cholinergic syndrome, main problem is diarrhea, and you give loperamide. Loperamide can be given, ठीक है. Procarbazine, disulfiram like reaction, ठीक है, disulfiram like reaction, you can give that. Yes, it has the highest chances of causing secondary leukemias also. That's another thing. It's highest leukogenic potential जो भी होता है. So that is about these specific adverse effects. Then we have some common adverse effects. So they have been asked time and again, repeatedly, very, very important, कि क्या use करना चाहिए? What to use in the common adverse effects. ठीक है? What to use in the common adverse effects. Anemia के लिए we are using epopoietin alpha and DAB. So all this erythropoietin, recombinant erythropoietins like epopoietin alpha, dabopoietin alpha. Yeah. Neutropenia, filgrastim, was asked in recent examination. Tumor lysis syndrome, which leads to accumulation of lot of because breaking down of the proteins, the pyrimidines and all, so it leads to a lot of uric acid formation. So to synthesis decrease करने के लिए we can use allopurinol, and there's also raspuricase. Thrombocytopenia, yeah, very good. Opral vacant. Mucositis, ठीक है, the mucous skin is coming off. So what you do, you use a recombinant keratinocyte growth factor, which is palifermin. ठीक है, for that. Nausea, vomiting, definitely, we are using 5-HT3 antagonist mainly, which is your ondansetron. ये important common side effects के prevention है basically. So they have been asked, and this is a list of the specific side effects which are most important. No, right? Okay. Here, yeah, that's the question which is on L-asparaginase. What is the use of L-asparaginase out of these? Acute lymphocytic leukemia, acute myelocytic leukemia, chronic myelocytic leukemia, CML or CLL. What is the use of L-asparaginase? Where is it used out of all of them? Yes, very good. It is used in ALL. And what is that regime? ठीक है? The regime, I'll be showing you the important regimes also, but these are the important, this is the important regime for ALL. ठीक है? Important regime for ALL. So what does VAPD mean? What does VAPD mean? VAPD? चलो. A here is for asparaginase. P is for prednisolone. ठीक है? This is an important regime. Not regimes for everything is important, but like for some of the drugs. नहीं याद? Okay. कोई बात नहीं कर लो. V is for not all the regimes. I'll be showing few regimes. उसको याद कर लो because sometimes they ask which is the drug used in that. सारे regimes use करने की जरूरत नहीं है. Vincristine, prednisolone, asparagine and daunorubicin. ठीक है? I'll be showing you a slide for that. Daunorubicin. ठीक है? So ये important regimes हैं to remember. So what is important here is L-asparaginase role in leukemia क्या है? It inhibits an enzyme. Mechanism sometimes they ask you. So it inhibits an enzyme L-asparagine synthase. Inhibits the enzyme L-asparagine synthase. ठीक है? And what it does is जो metabolite, it is essential. Asparagine is important for the cancer cells. They use it as a essential metabolite. So it will degrade that essential metabolite to aspartic acid. That's the role in leukemia. So what are the side effects of L-asparaginase? One is hyper GCLS. It causes hyper GCLS, glycemia, ठीक है? Coagulability or coagulation, hypercoagulation, lipidemia and sensitivity. And the last one, उसके अलावा है pancreatitis. These are the important adverse effects of L-asparaginase, hyper GCLS and pancreatitis. ठीक है? So all these are 4 hypers. Yes, ये 4 hypers cause करता है और उसके अलावा pancreatitis cause करता है. But enough to know about L-asparaginase. Now the next question is, which of the following is used to treat hormone responsive breast cancer? Which of the following is very simple, ये तो easy है. Which of the following is used to treat hormone responsive breast cancer? Easy hai. This one is easy. Very good. Tamoxifen. Okay, so it is tamoxifen which is used to treat hormone responsive breast cancer. This is also very important. What is the side effect with diethylstilbestrol? And clomiphene कहाँ use होता है? ये another important question. Clomiphene कहाँ use होता है? क्लोमिफीन, क्लोमिफीन किधर यूज होता है? Yeah, I know that. Clomiphene, vaginal, yes. So this is, it can cause vaginal cell carcinoma, adenocarcinoma in the female offspring. So therefore, it can't be given to pregnant females. Clomiphene is used for infertility. Very good. इसमें एक rule of 5, I always say 50 milligrams for 5 days. Start on 5th day of menstruation. ये इसका रेजिम है. 50 milligrams for 5 days starting on the 5th day of menstruation. ठीक है. So this is important about clomiphene citrate. Is also a very important drug. ठीक है. Now breast cancer and the treatment. Important है. ER positive का treatment क्या है? Tamoxifen. ठीक है. But if it is post menopausal, then letrozole. HER2 positive, HER2 positive, ये सारे टीम इसमें है हमारा. Trastuzumab. Yes. Tamoxifen, premenopausal, postmenopausal, letrozole, and if it is HER2 positive, it is trastuzumab. Even if it is a HER2 positive gastric cancer, yes. अगर gastric cancer में भी HER2 positive है तब भी हम trastuzumab यूज करेंगे. ठीक है. So ये important है regimes for breast cancers. Very important, very very important. Now this one. Which of the following drugs has been recently approved for treatment of prostate cancer? Now इसमें only you have to know which is the recent approved drug. ठीक है. There's no what do you call the essence इसमें सिर्फ है आपको recently approved का पता होना चाहिए कौन सी न्यू है इसमें से basically. इसमें पता लगा हम books में we have been reading some of the drugs for so long and one of the drugs has just come up. So only thing you should know which is the newer drug here. ठीक है. And the newer drug which has recently come up is your 4. Yeah, it is 4 because ये initially you see books में कई सालों से है ये. So that's why they are not recent. So recent is your degarelix, GnRH antagonist. ठीक है. Now, one thing is here, I'm not sure whether they can ask you this, but because it's not actually a drug. It's a first targeted radioligand therapy बनी है for the progressive treatment जो काफ़ी advanced stage prostate cancers होते हैं which are resistant to already जो GnRH antagonist, anti-androgens, they are resistant to that. So this is a new because there's no it's not a drug, it's just a radioligand therapy. Just for knowledge, just इसको बाद में याद करने की जरूरत नहीं है. अभी बस एक बार glance कर लो कि अगर पूछते हैं कभी so you have read about it. ठीक है. It is recent, very recent, 2023 approved by FDA as the first targeted radioligand therapy. So just अभी इसको बस take a ठीक है. हाँ बाकी पड़ी हुई है कहीं. Yes, that is the only thing. वो पड़ी हुई है तो इसलिए no, that is important. इसको और अभी हमने और कुछ करने की ज़रूरत नहीं. We don't have to read anything else about it. इसको बाद में भी नहीं पढ़ना है. It is just अभी देख लो and सोच लो कि हाँ ये एक था न्यूअर रेडियोलाइगेंड थेरेपी आया है बस. ठीक है. इस पर बहुत टाइम नहीं वेस्ट करना. So there are few important cancers now. ठीक है. With their therapies. I'm not going to tell you to read all the cancers with therapy. It's slightly difficult. ठीक है. अगर जो कुछ याद किए हैं बहुत अच्छी बात है. Cisplatin actually इसमें है ये काफ़ी जगह. It is used in a lot of cases. It's a slightly important drug which is used in a lot of cases. Head, neck और esophagus. ठीक है. इनके cancers में, lung cancer में, cervical bladder cancer में यूज़ होता है. और monoclonal antibodies also, I will in the end I'll give you a list. we are not supposed to know everything about any monoclonal antibodies. थोड़ी बहुत जितनी भी याद रह सकती है, don't waste much time. वो एक चार्ट है that is more than enough to remember. ठीक है, we are not going to go into details of monoclonal because don't waste time on that. ठीक है, so this is what my intention is to tell you. Then ठीक है, cisplatin important है, and then कुछ regimes which can be asked. It's like B testicular cancer है, इसमें एक PEP regime है. ठीक है, bleomycin, etoposide, and these are your platinum compounds. Don't confuse it with like prednisolone etc. This is for platinum compounds. Cisplatin, anything can be used. ठीक है, कोलन कैंसर मैंने ऑलरेडी बताया, ये इंपॉर्टेंट है. फॉल फॉक्स फॉल फ्री रेजिम. ठीक है, तो इट्स ईजियर का फॉल से आप फोलिनिक एसिड and F से 5-fluorouracil. OX stands for oxaliplatin. Similar, the first two are same here. IRI stands for irinotecan. This is easy to know. ठीक है, anal rectal cancer, even if you forget, I won't lay stress on this. ठीक है, इसमें भूल भी गया तो it's okay. Yes, hepatocellular cancer and this, ये ज़रूरी है. Actually tyrosine kinase inhibitors थोड़े बहुत जो आए हैं, they are important to know. थोड़े बहुत इसके लिए भी मैं will tell you later which are more important to know. Sorafenib, because it is first line for hepatocellular cancer, तो ये important है. Choriocarcinoma we talked about, methotrexate, yes. And malignant pheochromocytoma याद रहता है, ठीक है, नहीं याद आता तो भी ठीक है. ठीक है, vincristine, cyclophosphamide, dacarbazine. Even if you forget, it's okay. Let's not worry about this. ठीक है, बाकी जो है cisplatin जैसे important है, colon cancer की regimes important है. TKI में hepatocellular cancer, methotrexate, these are important ones. ठीक है, then bone marrow cancers जो important है, the regimes basically जहाँ पे हैं. For example, ALL में we did vincristine. ठीक है, इसमें prednisolone, L-asparaginase and daunorubicin. ठीक है, so that's your VAPD regime. This is important for this. Out of all this, if you have to remember, actually I will, some CML बहुत important है. Hodgkin disease is very very important. Even non-Hodgkin पूछते हैं. ठीक है, and ALL, pretty nice. But these are the maximum regimes I can actually tell you जो important है. बाकी आप सारी भूल जाओ, you let it be. ठीक है, so but ये regimes ऐसी हैं, you can take a snapshot later and write it. For this is something which you might forget later, so this is just for your last minute revision की, just go through this and फटाफट revise करो, because ये काफ़ी volatile है, ये भूल जाती हैं बार बार. ठीक है, so CLL, FCR, fludarabine, cyclophosphamide, rituximab. ठीक है, so CLL is FCR. ठीक है, now CML, this I will talk in detail also अभी later, because ये काफ़ी important है. इसमें जो tyrosine kinase inhibitors है काफ़ी important है. I will also talk in detail later, but this is very important. Imatinib is your first generation drug. ठीक है, that is a drug of choice. अगर नहीं काम आती, if there is resistance, then we go to the other drugs. But please remember this, CML. Hodgkin's disease, important. ABVD, so this is adriamycin. ठीक है, so remember ABVD, adriamycin. ठीक है, bleomycin, vinblastine, dacarbazine. ठीक है, dacarbazine, vinblastine, adriamycin, bleomycin. Non-Hodgkin lymphoma, CHOP-R. ठीक है, CHOP-R regime, and CHOP-R में है cyclophosphamide. ठीक है, hydroxydaunorubicin है इसमें, hydroxydaunorubicin. O is for oncovin, it is another name for vincristine. ठीक है, P is for prednisolone, R is for rituximab. ठीक है, R is for rituximab. Multiple myeloma, they've asked about this bortezomib. If you can remember this, bortezomib. ठीक है, for multiple myeloma. And polycythemia vera, हमने कहा sickle cell anemia, we have already done that also. ठीक है, hydroxyurea, ये important है. So this I think is more than enough if you remember these. और ठीक है, for the cancers treatment. Let's go to this one. Now this is, now there comes the important part. These are important. When we come to some amounts, कुछ जो monoclonal antibodies, they are newer monoclonal antibodies, or the newer favorite with the papers are these ones. So the question was, nivolumab is used for the treatment of. Nivolumab is used for the treatment of. ठीक है, nivolumab, yes, very good. ये रट्टा मारने वाली बात है, कर लेना. Hodgkin's lymphoma. So it is an immune checkpoint inhibitor. ठीक है, immune checkpoint inhibitors absolutely essential. You cannot skip this for the current paper. You have to read this. Then there are certain other uses of nivolumab. अगर उन्होंने आपसे पूछा है this time Hodgkin's lymphoma, it can be asked in some other form in the next question. ठीक है, so ये 3 are most important. Metastatic melanoma, non-small cell carcinoma, Hodgkin's lymphoma. These 3 are the most important uses. ठीक है, then there are others. See how many you can remember: renal cell carcinoma, squamous cell, urothelial, colorectal, hepatocellular. But ये 3 more important. Nivolumab. ठीक है, metastatic melanoma, non-small cell carcinoma, lung carcinoma, and Hodgkin's lymphoma. These are the most important uses of nivolumab. ठीक है, now coming to the immune checkpoint inhibitors. Very, you up questions तो आए हुए हैं, so most likely they will be asking you another question on these immune checkpoint inhibitors. So you know that immune checkpoint inhibitors होते क्या हैं? T cell, normal cell. ठीक है, they have a receptor which is called programmed death receptor 1. Right? So programmed death receptor 1, the main aim is that they will find out the cells that are not good or not like you in the body, and they will kill those cells. So that is the main thing here. So what happens in the normal cells? Why doesn't the PD-1 kill the normal cells? Because they have, let's see, they have a key which fits in this lock, and when the key locks, तो उसको पता लग जाता है कि this is my own cell. ठीक है, it doesn't have to harm us, and this is your programmed death receptor ligand. ठीक है, ये ligand होता है इसके लिए. So the ligand will bind to the receptor, and the cell knows that this is my sister or my brother, and I don't have to harm this. But the cancer cells usually don't have this. So that's why it can damage the cancer cells. But now cancer cell, they are very intelligent. So they want to protect themselves. So what do? They make a duplicate key. अब वो एक duplicate key बनाते हैं. So they also make a duplicate key like this only. ठीक है? PDL1. So अब क्या होता है, जब ये duplicate key will attach here, it will bind here. So T cell को लगेगा that cancer cell is also my own, my brother and sister here, and it will not harm the cancer cells. So that is why it will allow the cancer cell to flourish in the body, and cancer हो जाएगा. अब जो हमारे ये these are called as immune checkpoints. ठीक है, वो चेक पोस्ट होते हैं ना, पुलिस के चेक करते हैं कोई घुस तो नहीं गया हमारे घर में ऐसे, या कुछ तो नहीं हमारी बॉर्डर क्रॉस कर लिया. तो ये भी चेक पॉइंट्स ही हैं बेसिकली, इनको चेक करने के लिए. जो सेल है ये मेरा अपना है कि ये कोई दुश्मन है. ठीक है, तो दिया अगर जिसने उसको की दिखा दी, दैट्स देयर ओन, और जिसके पास की नहीं है उसको ये मार देगा. बट अब कैंसर सेल ने डुप्लीकेट की बना ली है एंड उसने की दिखा दी है और की उसमें फिट हो जाती है. सो द कैंसर दिस टी सेल नोज दैट दिस कैंसर सेल इज माइन. राइट. अच्छा, ठीक है. सो ये इसका मतलब होता है चेक पॉइंट. ठीक है, चेक पॉइंट का मतलब ये. अब इम्यून चेक पॉइंट इनहिबिटर का क्या मतलब हो गया? तो अब ये कैंसर सेल के जो की है उसको हमें बंद करना पड़ेगा. तो हम कैसे बंद करेंगे उसको? वी विल गिव द ड्रग्स विच विल इनहिबिट आइदर दिस और इट विल इनहिबिट दिस. दोनों में से किसी को इनहिबिट करना पड़ेगा. ठीक है. सो उसको या इसको इनहिबिट करना पड़ेगा या इसको इनहिबिट करना पड़ेगा. तो कुछ ड्रग्स हैं जो इधर इनहिबिट करती है रिसेप्टर को, कुछ ड्रग्स हैं जो लाइगेंड को इनहिबिट कर देती है. सो दे आर योर इम्यून चेक पॉइंट इनहिबिटर्स. बस इतना ही आपको पता होना चाहिए. व्हाट आर द इम्यून चेक पॉइंट इनहिबिटर्स. एंड ये आपके पास निमोनिक है, इसको याद कर लो. ये एवरीवेयर इट इज देयर दिस निमोनिक. न्यू स्टार ड्रग्स एक्टिंग एट इम्यून चेक पॉइंट. ये अभी तक था. द एडिशन जो हुआ है लेटेस्ट, दिस इज अ न्यूअर ड्रग अप्रूव्ड इन मार्च 2023. नोट दिस डाउन. देयर इज लाइकलीहुड दैट ये पूछा जाए. ठीक है. तो अभी तक द निमोनिक वाज न्यू स्टार ड्रग्स एक्टिंग एट इम्यून चेक पॉइंट. नाउ एड अनदर, लास्ट में ऐड कर दो रिसेप्टर्स. दिस इज द निमोनिक. सो विद एन इट इज निवोलुमैब. स्टार का एस स्टार है ना, पूरा स्टार. इट इज इन द ड्रग विच इज डोस्टारलीमैब. ड्रग्स का डी इज डुरवालुमैब. एक्टिंग ए वन इज एविलुमैब. अनदर एट इज एटिजोलिमुमैब. आई इज फॉर इपिलीमुमैब. प्लीज इसको याद करना ही पड़ेगा. देर इज नो वे बिकॉज इम्यून चेक पॉइंट दे कैन आस्क यू विच ऑफ द फॉलोइंग इज एन इम्यून चेक पॉइंट इनहिबिटर. सो रिमेंबर दिस निमोनिक एंड देन यू विल इट विल बी इजियर फॉर यू. ठीक है. चेक इज सेमीप्लिमैब. पॉइंट इज पेम्ब्रोलिजुमैब. एंड रिसेप्टर्स है, ये लेटेस्ट आया है रेटिफैनलीमैब. ये जो CTLA1 है, दिस इज ऑल्सो अ काइंड ऑफ, जैसे हमने प्रोग्राम डेथ रिसेप्टर किया था, CTLA4 भी एक ऐसा ही रिसेप्टर है विच ऑल्सो रिकग्नाइजेज कि मेरा अपना सेल है तो उसका लाइगेंड है. तो अगर वो लाइगेंड मिला उसको तो वो उसको डैमेज नहीं करेगा बट कैंसर सेल को डैमेज कर सकता है. तो दीज आर बोथ आर द इम्यून चेक पॉइंट रिसेप्टर्स जिसे कहते हैं, PD1 एंड CTLA4. अब तो ब्रैकेट्स में मैंने मेंशन किया है. वैसे इट इज़ नॉट एसेंशियल टू नो कि कौन सा PD1 के अगेंस्ट है, कौन सा PD1 के अगेंस्ट है. आई जस्ट रिटन इट फॉर यू टू नो कि वन सम आर अगेंस्ट द PD1s एंड सम आर अगेंस्ट द PD1s. नॉट रियली एसेंशियल टू नो. ठीक है. सो ये वाला इसलिए मैंने इंक्लूड किया. दिस इज द लेटेस्ट. सो रिमेंबर दिस. ठीक है. ऑल्सो इट माई नॉट बी गिवन समवेयर. सो yeah, this is dostarlimumab वो वाली anal cancer 100% remission. I maybe no idea, मुझे खुद इसका बहुत क्लियर कौन नहीं है. आप देख लेना इसको. ठीक है. I will tell you about the others. 100% remission. Okay, maybe just check on this. ठीक है. No, I have no idea about this. You can just check on this. Nivolumab basically main मैंने कहा था Hodgkin lymphoma, याद रखना. ठीक है. एंड द रेस्ट जितने मैंने आपको बताए हैं उसके यूजेस, एटलीस्ट द फर्स्ट 3, द रेस्ट आर इफ यू कैन रिमेंबर, अदरवाइज फर्स्ट 3 एसेंशियल टू रिमेंबर. ठीक है. डुरवा इज डर ब्लैडर आता है तो इज यूज फॉर ब्लैडर कैंसर. ठीक है. ब्लैडर कैंसर. इवन एटिजोलिमुमैब इज फॉर ब्लैडर कैंसर. ठीक है. Then evilimumab, this is for Merkel cell cancer. ये भी और ये भी Merkel cell cancer दोनों है. ठीक है. टाइप ऑफ स्किन कैंसर होता है Merkel cell cancer. Then Ipli is for ip for malignant melanoma. ठीक है. सेमीप्लीमैब स्क्वैमस सेल कार्सिनोमा. पेम्ब्रोलिजुमैब मैं अलग से बताऊंगी. वैसे इट इज द वेरी इंपॉर्टेंट फॉर एंडोमेट्रियल कैंसर. वेरी इंपॉर्टेंट आर दीज टू आर द मोस्ट इंपॉर्टेंट जिसके बारे में पूछा गया है, इसलिए निवोलुमैब एंड पेम्ब्रोलिजुमैब. These have been asked as questions like where are they used. So that's why I'm telling you the uses of these two especially in detail. Nivolumab and pembrolizumab. Inke uses and details. This is important because it is new, so likelihood of asking. Rest may or may not be asked, but you this slide na कुछ भी नहीं करके जाना है इसमें से, तो एटलीस्ट इम्यून चेक पॉइंट इनिबिटर्स ये ज़रूर करके जाना है. अगर मोनोक्लोनल कोई भी नहीं करनी है, एटलीस्ट इम्यून चेक पॉइंट इनिबिटर्स की मोनोक्लोनल जितनी एंटीबॉडीज है ये ज़रूर करके जानी है. यस, एंडोमेट्रियल कैंसर. आई विल टेल यू द अदर. ठीक है, ये यूजेस ऑफ पेम्ब्रोलिजुमैब यू नीड टू नो दिस. सो रिमेंबर पेम्ब्रोली की स्पेलिंग में पेम्ब्रोल. तो प्राइमरी यूज उसका है एंडोमेट्रियल कैंसर. Primary use is endometrial cancer. M, it is also used for melanoma. B is for breast cancer. R is for renal cell cancer. O is for esophageal cancer. L is for lung cancer, non-small cell cancer. These are the important uses of pembrolizumab. Because this has been asked, so there is chances that they might ask you the other also in options. They can, they have a tendency to repeat or go around that topic. So high probability, so do these two at least, pembrolizumab and nivolumab. Inke uses all are important, right? So these are your immune checkpoint inhibitors. Very, very, very important currently at least. Okay? And this is what I was talking about. This kind of picture. If they show you what is this picture. This is radiation recall syndrome. ठीक है, radiation recall syndrome. So there is suppose radiation of the it is radiation recall syndrome. ठीक है, especially अगर head and neck cancer किसी को है and radiation therapy दी हुई है, so radiation recall syndrome, and you've done the drugs and even these your नो इसको देख लो. अब ऐसे अगर आएगा तो रेडिएशन रिकॉल सिंड्रोम है, यूजुअली है. उसमें ड्रग्स ऑप्शन से पता लग जाएगा. इफ दे आर गिविंग यू एंटी कैंसर ड्रग्स इन द ऑप्शन विल कम, बिकॉज देयर आर सो मेनी ड्रग्स व्हिच कैन कॉज दिस रेडिएशन रिकॉल सिंड्रोम. ठीक है, सो इसमें इवन योर इम्यून चेक पॉइंट इनहिबिटर्स कैन कॉज. वी हैव ऑलरेडी डन. ठीक है, या इम्यून. एक आज से काम करना, गूगल पे रेडिएशन रिकॉल सिंड्रोम के पिक्चर्स देख लेना जितने भी हैं. एटलीस्ट यू कैन एन आइडिया ऑफ, they can put any picture and they can ask you, so at least you have an idea कि अच्छा यहाँ पूछेंगे तो it's a radiation recall syndrome, you can put that. ठीक है, so immune checkpoint inhibitors cause करते हैं and हमने already किया कि doxorubicin भी cause कर सकता है. या recall not हाँ. ठीक है, alright, let's go to the next important topic and इसमें हम करेंगे which of the following drugs act by the mechanism as shown in the figure by the arrow. मतलब ये वाला. Yes, very good. It is imatinib. ठीक है, so imatinib, a tyrosine kinase inhibitor. It works here and acts on the BCR ABL. So again, tyrosine kinase वाले important हैं. And you know what is BCR ABL? 2 chromosomes हैं. Chromosome number 22 and chromosome number 9. Chromosome number 22 में होती है BCR gene. Chromosome number, very good, yes, ए पे होती है ABL जीन. सो व्हेन देयर इज अ ट्रांसलोकेशन दोनों में, तो BCR भी आ गई इधर और ABL भी आ गया इधर, इसी में एक ही जीन में. दैट इज योर फिलाडेल्फिया क्रोमोसोम. यस, and this abnormal chromosome, this is your oncogene, cancerous gene hai, which is this BCR-ABL gene. And what it starts doing is, ये जो टायरोसिन काइनेज होता है रिसेप्टर को, इसको परमानेंटली ऑन कर देते हैं. And you know the tyrosine kinase, जितने भी receptors, whenever they start acting or functioning, they're important in cell proliferation, cell growth. So when this tyrosine kinase receptor, they are permanently turned on because of this abnormal gene, what it does is, it will increase the proliferation, increase the growth. And that's how the reason for CML is there. This is the reason for chronic myeloid leukemia. And the drug which is active, or the first choice in CML, is your imatinib. And what is the area where it binds? If they can ask you, it binds to the ABL portion. It binds to the ABL portion. If you see here, it binds to the ABL portion, and it doesn't allow the attachment of ATP. Okay, binds to the ABL portion, and it does not allow the attachment of ATP. और अगर ATP attach नहीं होगा तो ABL won't be activated. That is the reason for, so this is the main mechanism of action of imatinib. ठीक है, imatinib. So imatinib also inhibits a platelet. So this is another, you have various types of tyrosine kinase receptors. So platelet derived growth factor is also a tyrosine kinase receptor. So imatinib also inhibits the platelet derived growth factor. और ये कहाँ पे इम्पोर्टेंट है, कौन से कैंसर में इसका रोल है? इट इज योर कैंसर विच इज कॉल्ड एज जिस्ट, गैस्ट्रो इंटेस्टाइनल स्ट्रोमल ट्यूमर. जिस्ट, गैस्ट्रो इंटेस्टाइनल स्ट्रोमल ट्यूमर. ठीक है, इसका रोल इसमें है. एंड व्हाई आई एम टेलिंग दिस अगेन, दिस इज वेरी इंपॉर्टेंट. ठीक है, इसकी ड्रग्स जो है, एक है इमेटिनिब, वन थिंग, यस, देन sorafenib, it is the second drug for gist, and third is rigorafenib. sorafenib, ये तीन ही ड्रग्स हैं इसके लिए इम्पोर्टेंट. वन इज imatinib, one is sorafenib, and the other is rigorafenib. So this is on the platelet derived growth factor. Now coming back to CML, अगर CML में drug of choice आपकी है imatinib. If it doesn't work, or you can say there is resistance to this, अगर resistance हो जाती है इससे, then we go to the second generation drugs which is dasatinib, nilotinib. ठीक है, and bosutinib. फिर भी resistance है, then the last is ponatinib. ठीक है, so last is your ponatinib. First generation usually use resistance, then you go to the second generation, is dasatinib, nilotinib, bosutinib. Still resistance, then you go to the third generation, which is your ponatinib, and it has, this is the adverse effect with them, hemorrhage or life-threatening blood clots, basically. This is this one is very important. ठीक है, द फिलाडेल्फिया क्रोमोसोम, BCR-ABL, ये सारा एक ही है. ठीक है, सो ऑल एसोसिएटेड विद CML एंड द टायरोसिन काइनेज इनहिबिटर्स इन्वॉल्व्ड. नाउ द फ्यू स्लाइड, ये जो लास्ट 2 स्लाइड्स मैं आपको दिखाऊंगी, these are just to tell you about the important tyrosine kinase. There are so many tyrosine kinase inhibitors. Probably the ones which are marked in yellow are the most important to know. ठीक है, the rest are good to know. ठीक है, so at least the important ones जो हैं, and जो green ones हैं, these are the newer ones actually, जो नए हैं इसलिए important. आ सकते नहीं आ सकते, यू जस्ट रिमेंबर, सी येलो पे सबसे ज़्यादा फोकस करना है. ठीक है, सो जो आपके एंजियोजेनेसिस रेगुलेट करते हैं, VEGFR, इसमें कौन सी काइनेसिन इनहिबिटर है? सुटिनिब, सोराफिनिब, पैजोपिनिब. ये 3 इंपॉर्टेंट ड्रग्स हैं, सुनिटिनिब, सोराफिनिब, पैजोपिनिब. सुनिटिब में का इंपॉर्टेंट है, इट इज़ यूज्ड इन द रीनल सेल कैंसरोमा, वेरी इंपॉर्टेंट फॉर रीनल सेल कैंसर. सोराफिनिब हमने अभी किया, वन इज जिस्ट and the other one is liver cancer or hepatocellular cancer. That is it. ठीक है, Jeftinib, erlotinib, important for metastatic non-squamous cell cancer of the lung. ठीक है. Erlotinib के साथ प्रॉब्लम है, food increases its absorption, has been asked. ठीक है. So therefore toxicity बढ़ जाती है with food. erlotinib की. HER2 के लिए एक हमने monoclonal antibodies किए थे. Yes. Sunitinib for renal cell cancer. Yes. Lapatinib is important for breast cancer. ठीक है. जो एक न्यू है ट्यूकाटिनिब, इफ यू कैन रिमेंबर, इट इज स्पेसिफिक फॉर HER2. ये जो पेरी दोनों है, लापाटिनिब एंड निराटिनिब, दे आर बोथ फॉर HER1 एंड HER2 एज सच. जानस काइनेस की भी हैं, रुक्सोलिटिनिब, टोफाटिनिब. So these are all the tinibs which are there. Yellow ones, again I'm repeating, do them. Baki you can forget. It's okay if you can't remember them. It's fine. ठीक है. So the last one में जो येलो वाली है, हम उस पे आते हैं. सो ये इजी है. मैसेटिनिब अगर कहाँ यूज होती है, मैस इज फॉर मास सेल ट्यूमर. ठीक है, मास सेल ट्यूमर्स में यूज होती है. ये वैंडिटिनिब होएगा, वैंडिटिनिब. ठीक है. एंड इसको याद करना है, वो वंदे मातरम, वैंडे एम इज मेरिलरी थायराइड कैंसर. ठीक है. और एक हमने अभी की है रिगोराफिनिब, दैट इज फॉर एडवांस्ड जिस्ट basically and colorectal cancer. So I think if you do the yellow ones out of them, you're good to go. Okay, good to go for that. These ones, the rest ones, I will tell you that just if there is time, agar nahi bhi aata, I will not suggest that you can just easily forget them. Just know the yellow ones which are most important. ठीक है. And ये एक monoclonal antibodies के लिए भी again I will tell you the same thing. ये जो monoclonal antibodies हैं, the ones which you've done in different chapters, tabulate them. These are the only ones that you should know. You don't have to go around learning each and every monoclonal antibody. Not practical, not possible. ठीक है. Do not stress on these. These are the few monoclonal antibodies. If you can just take a snapshot and just see them and look at them towards the end, because these have been asked. So these are the only ones. If you do, I think you are good to go. You don't have to go through all of them. So I've tried to collect as many which were important, which have been asked previously. The rest you don't need to bother also. ठीक है. और अगर आपको कोई लगता है कोई additional which is not present here, just write it down here itself. But just take a snapshot for this, and a night before the exam, or the morning, just go through this list, so that it's fresh in your mind and you can easily recall them. It is for that. ठीक है. स्नैपशॉट के लिए बेटर है, इसको अभी याद करने का कोई फ़ायदा नहीं है. सो आई थिंक दिस वॉज ऑल अबाउट द एंटी कैंसर में जो इम्पॉर्टेंट चीज़ें हैं. ठीक है. सो वी हैव डिस्कस द सेल ड्रग्स एक्टिंग ऑन द वेरियस फेजेस ऑफ सेल साइकिल्स. जो भी डिस्कस किया है, अगर आप इसको एक बार देख लोगे, आई थिंक इसके अलावा आई डोंट थिंक देयर इज मच यू शुड बी डूइंग फॉर एंटी कैंसर्स. ठीक है. ये भी मुझे बहुत लगता है कि इट इज़ वेरी डिफिकल्ट टू एक्चुअली मेमोराइज दीज थिंग्स, बट आई थिंक दिस सेशन, अगर आप एक बार, इफ यू कैन गो थ्रू एंड जस्ट टेक नोट्स वेर एवर योर नोट्स आर, जहाँ पे भी आपने किया इसको बनाया, उसके एनीथिंग एडिशनल राइट दैम. इट इज़ as much as you should know. I think nothing more is required from anti-cancers. Don't lay बहुत importance हम देते हैं because for INICET, but otherwise we don't say it is important. But जितना भी I have told you today, I think this is more than sufficient for you to know for the INICET, I guess. Okay, right? So next time I'm going to come up with something, I think either a mixed thing or maybe some other topic we'll take up, which is already discuss a lot of endocrine वगैरह हमने किया हुआ है. So maybe I'll see which is another relevant और ज़्यादा अगर कुछ होगा, और you can just DM me and let me know कि और कोई topics हैं जो हम कर सकते हैं. ठीक है. That we can do, revise the next time, maybe antimicrobial something. ठीक है. Most welcome Arnav, and I think सफिशेंट है. ठीक है. सो डोंट ले मच स्ट्रेस ऑन दी अदर्स थिंग. ज़्यादा टाइम नहीं इस पे और कहीं पे वेस्ट करना. ये सफिशेंट है आपके लिए. दैट इज़ इनफ फॉर यू. राइट. ऑल राइट. ओके देन, टेक केयर, स्टडी हार्ड, स्टडी वेल, ऑल द बेस्ट. सी यू. ओके.